First, I'd like to welcome and thank you all for coming out here to learn a little bit more about cannabis legalization, to listen to our stories, keep an open mind. When I was first asked to speak, I thought no problem. I've done a lot of media. My daughter Maya is an 11-year-old cannabis patient. I didn't really think much of it. I thought, yeah, sure, I'll get up and speak in front of 400 people, no problem. We've done the national. But then I realized who was going to be in the audience, and in my understanding, there's quite a lot of AHS workers here. I see a lot of physicians that I've had contact with previously. I know Calgary Police Services is here, and I think that's wonderful that we're all kind of coming together to learn about these things. Oh, and the one and only Kyle Wilson, I was bribed to say that. So first I want to tell you a little bit about how I got here, because if you were to tell me 10 years ago that I'd be standing up speaking about cannabis use in children and how it has positively affected my life, I would have thought you were all using harder drugs than cannabis. Maya's pregnancy, my daughter's pregnancy, went great. Shortly after birth, 29 minutes to be exact, she had her first seizure. From then, it didn't stop. She was diagnosed with early infantile epileptic encephalopathy of unknown etiology. So some of you will know that that means she has a lot of seizures and we have no idea why. So her prognosis was death, likely within the first 2 years. We were very fortunate that she made it past that 2-year mark. I think once we got around 2 years, I thought, what do we do now? She was still seizing daily, hundreds of times a day. We had her on cocktails of drugs. We prepared as much as we could for the inevitable. Her first drug, given, I'd say she was a few hours old, was phenobarbital, which is a barbiturate. That didn't stop the seizures, but it did make her lose her ability to eat. So she was no longer able to suck. She lost that ability. Dilantin caused acute liver failure. Codeine, she was actually overdosed accidentally at ACH, at Alberta Children's Hospital, a hospital which, to my knowledge, has a no codeine policy. Sabril, Kepta, the ketogenic diet, IVIG, clobazam, diazepam, Ativan, nothing worked to control the seizures. She also had a history of status epilepticus, which means seizure for, generally they say it's over 20 minutes, but Maya's shortest status was 2.5 hours. Her longest was over 23. And then that's when the big hitting drugs would come out. So she would get a pheno and midaz infusion or ketamine and propofol. And she was, we started doing this when she was a year old. Ketamine, we're in Alberta, so I know maybe there's a few farmers here, I don't know, but that is also used as a horse tranquilizer. And they had no issue giving it to my 1-year-old daughter to stop her seizures. We didn't have a choice, though. Then came the day that we had been dreading. She was 7 years old. She had come out of a 23-hour status seizure. She was in a medically induced coma for about a week, was having a very difficult time waking up, very traumatic extubation. And her physician sat us down and said there's nothing left for them to do. There were no other drugs to try. There were no other therapies. That was it. We had reached the end of our road. So we went home and told our boys. I have 2 teenage boys as well. And that was probably the hardest thing I had ever had to do. First, listening to her doctor telling us that her death was imminent, but the worst part of all that was sitting my boys down and telling them that their sister didn't have much left. That night, though, I couldn't sleep, obviously. So I'm up on the computer, as most special needs parents are, until 3 a.m. And there were murmurings of cannabis as medicine in pediatric epilepsies, namely Dravet syndrome, as Dr. Hill had stated. Maya was originally diagnosed with Ohtahara, which is closely related to Dravet syndrome. The only difference is basically is that the suppression burst pattern is constant, whereas in Dravet, I believe it's only during sleep or awake periods. So I knew that this was an option, but I also knew that it'd be very difficult in Alberta to find a signing physician for a pediatric case 4 years ago. So what did I do? I tried it on my own. I knew medical growers in BC. They had a 1-to-1 ratio of CBD to THC, which was, because at the time everybody was talking about CBD, 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 CBD for pediatric epilepsy. And the highest in Canada at that point that we could get was about a 1-to-1. So I did that. I learned myself how to make the oil. I took a lot of the research actually from Israel in dosing, and that's how I learned to dose her. The effects were immediate. She stopped seizing immediately. So after about 2 weeks, I decided to fess up to her doctors, cross my fingers, and hope I wasn't arrested. And he said, she hasn't seized at all, and I said, not at all. And he said, the papers will be signed in your email within the half an hour. And they were there in 5 minutes, and at that time, it was the MMAR program. So we were able to get that. But in order to get to that point, I actually had to separate from my husband because when we were trying it on our own, I was so afraid of Child Protective Services or the police that if we separated, he could feign ignorance. I would take the blame for it because he's a primary breadwinner, and I would take the fall for it and go to jail. And I'm not saying to do this. I'm not suggesting that anyone go out and do this. I'm letting you all know because it's absolutely ridiculous that I needed to do that to separate from my husband of, at the time, 14 years, just to give my daughter a quality of life and to stop her seizures. But then there was this wasn't a happily ever after, so you can save your claps, because after a year, a successful wean of all pharmaceutical medications, seizure-free, and a normal EEG, despite a slow background rhythm, which would be consistent with somebody who has any type of learning disability, her EEG was completely normal. And despite all of that, her doctor couldn't re-sign her. There was a new policy at Alberta Children's Hospital, and he was unable to sign. I felt that my best bet, because now at this point we're left again, she's an unauthorized pediatric cannabis patient. That doesn't put me in a very good position. So I felt that my best bet to protect her would be to go to the media because public support is crucial. This is, let's be honest here, if this was a health issue, this would have been studied and implemented into our healthcare system 60 years ago. This is more of a political and social issue than a medical one at this point. So we had to actually fly out to Ontario. We found a compassionate doctor in Ontario who signed and also apologized on behalf of his colleagues because the evidence was so overwhelming with the normal EEG, seizure-free, no medication, and only using cannabis oil. But even through that, we faced an enormous amount of judgment in and out of the medical community. But I didn't care because it worked, so they could judge away. Her physician had been the one to originally ask me to go to the media because he said, in his words, his hands were tied and then backed out at the last minute and wouldn't stand up for what he called a miracle. So a man of science believed there was more evidence for miracles than there was for cannabis oil working to control seizures, which kind of blows my mind. But so we talked to everybody who would listen, and all of the so once we went to the media and I explained our story and I told Maya does use the THC and she does use CBD because CBD does alone causes more myoclonus, so maybe the Dr. Hill can explain that because I have no idea why. But the 1-to-1 ratio seems to work very well for her. But people of all backgrounds judged. And, I thought just take one walk in my shoes. What would you do if you had something that could save your child, but the law prevents you from giving it to them? To me, it was really a no-brainer. The out-of-pocket expense alone to buy the cannabis monthly, because this is not covered by any insurance companies. I would rather put that $1,000 in my pockets than spend it on a medication that wasn't working. It's clearly working for her. And now we're on the horizon of legalization. Some are happy, some are angry, some are apprehensive, and I think all of us are a little anxious to see what's going to happen because the world is watching. The legislation is strict. In my opinion, I think it's a little too strict. I would be given more time in prison for giving a 17-year-old some non-psychoactive CBD than if I were to sexually assault that same 17-year-old. And as a cannabis patient myself, who uses it for PTSD from sexual abuse stemming from childhood, I can absolutely tell you that sexual assault is worse than cannabis use. We all want the clinical data. I want it. I was asked 4 years ago for Maya to be a part of a study out of Toronto Children's Hospital, sick kids. They are just beginning now. 4 years of bureaucratic bullshit and red tape to finally get a study going on a large scale. I want a large scale clinical trial because I know that this works. I see it every day. I see it in my daughter's eyes. And so we need this research, and that's why I'm pleased to announce that I've been nominated to the Cannabis Research Fund, volunteer board as a founding director. My motivation to help Maya and other kids, my heart lies with the kids, obviously. Like her, I believe will be an asset to the CRF's mission to support university peer-reviewed study and research, industry-funded. And through all of this, through all of the stigma, the judgment from the medical community, from socially, I decided to take that and create something out of that. I thought, you know what, there are so many, I've spoken to hundreds of special needs parents who are either using cannabis oil as a treatment for their children or wanting to use it. And we all face the same thing, and that's stigma. So I said, you know what, we can do better. We can do better for medical patients. And so that's where the idea of Maya's Temple grew. And we are now partnered with a national company, NAC. We have a network of doctors available to us, cannabis-friendly doctors, that we can set patients up, no fee. Obviously, we're an education center and also like a health center. We do yoga and things like that in the back and meditation. So as you know, everybody comes up to tell their story. Everybody's story is going to be different. Today I was asked to speak about Maya. I've got my own story. These people up here have their own stories, and I see a lot of familiar faces in the audience that have their own stories. I implore you to listen, to keep an open mind, to put aside the indoctrination that we all grew up with, that just say no, drugs are bad. And they are, but cannabis is an effective medicine. And it has completely changed my life. It has brought my family back together. And although I may not have my daughter forever, the fact that I've been able to give her, or that cannabis has been able to give her 3.5 years of seizure-free time with me, the fact that she can now say, Mama, that's really all the evidence that I need, personally. But let's get these clinical trials going. Let's get this research going. We want it too. Cannabis patients want it too. We're not saying no to science. We're saying yes, science, please. So let's cut through the crap and get these clinical trials going because we need this evidence. There are children dying every day because of the lack of evidence. So please keep an open mind while you're listening to these stories. And if you have any questions, I guess, write them down and we'll discuss them at the end. And that's all I have to say.